presented by Ashley Otten, Ashley Ratner, and myself, Summer McAleese. Lyme's disease does not target any specific gender, sex, culture, or ethnicity. This disease has multiple signs and symptoms that typically appear 7 to 14 days after being bitten. One is likely to notice a bullseye ring type of rash that occurs at the site of the bite, along with fever, chills, fatigue, and body aches similar to the symptoms of influenza. A diagnosis of Lyme disease is reached using a set of tests: the enzyme-linked immunosorbent assay, also known as a ELISA test, or the Western blot test. The target population that is most likely affected by Lyme's disease are boys between the ages of 5 and 19 living in the state of Connecticut. This is because males in that age range are more prone to engage in activities in wooded or grassy areas. According to the CDC, boys in this age group are at a higher risk of contracting the disease over boys and girls ages 5 to 9 combined. Between the years of 2003 and 2005, over 64,000 cases were reported in the United States. 93% of those came from states in the Northwest, with Connecticut being the state to report the most at 1,810, with the rate of incidence of 53 per 100,000 population. Between 2001 and 2010, there were approximately 33,000 boys that became infected with Lyme's disease, with those in the ages of 5 to 19 having almost 50% higher risk of incidence over girls. Why are so many of these boys picking up ticks? Children that spend a lot of time outside in heavily wooded and grassy areas are more susceptible to tick bites, especially when they are wearing shorts, short sleeves, and not using insect repellent. Lyme's disease is not considered a fatal disease. The mortality rate is nearly non-existent. Those who have perished do so due to complications caused by the disease, not the disease itself. But morbidity continues to be on the rise. Connecticut is the state with the highest number of cases, 248,074, within a 15-year study period. According to the Center for Disease Control and Prevention, the number of cases increased by 101%, from 9,908 cases in 1992 to 19,931 cases in 2006, and in 2012, that number was over 22,000. Incidence statistics provided by the Center for Disease Control and Prevention showed that in 1992, 53.7 out of the 100,000 cases, that 25% of the infected individuals were children. More than half specifically were the boys between the ages of 5 and 19. In 2002, there were 133.9 cases in 100,000, and 60% of those infected cases were children, with at least 50% of those infected being boys ages 5 to 19. Lyme's disease can and does affect any culture, ethnicity, or background, but happens occur 3 times the average rate of boys 5 and 19. The relationship between prevalence and incidence in Lyme's disease is a close one. The prevalence of this disease in our target population is increasing due to the high incidence of the disease. Factors related to increased incidence are location, having pets, spending time outdoors, and participating in activities such as fishing, hiking, camping, or hunting in tick-infested areas. In order to prevent future Lyme's disease outbreaks, Connecticut needs to develop policies that are safe, efficient, and accurate. In addition, essential services should be continued to be involved in the management and support of the community. The American Lyme Disease Foundation. The goal of this foundation is to educate the community about the prevention and avoidance of ticks. These doctors and advisors recommend products not only for prevention in humans, but for our animal companions as well. Frontline works to protect our pets. Permethrin can be applied directly to our clothing to repel ticks for people. DEET, spelled DEET, is another insect repellent that can be used to combat ticks and can be applied directly to fabric. The ALDF also provides educational material stressing the importance of prevention and intervention of Lyme's disease. The LDF monitors health, diagnose, and investigative measures with Lyme's disease. The Ridgefield Lyme's Disease Task Force, located in Lyme, Connecticut, is a unique nonprofit organization that is ran by caring volunteers who have direct experience with and the impact of tick-borne diseases. They offer preventative programming, patient support services, and seminars. The first annual Lyme's Disease Conference was held in 2007. Now it is every year in May. They have a monthly support groups and educational seminars and newsletters that partly in thanks to their $50,000 startup grant from the Connecticut Department of Public Health. It is because of the Ridgefield Lyme's Disease Task Force that HB 6200 was drafted and passed in 2009. This piece of legislation essentially protects physicians in practice in Connecticut. Lyme Connection also monitors the diagnosis procedures and process and investigates different measures within Lyme's disease. The Lyme Research Alliance. Their main goals are promoting Lyme's disease awareness groups, serving as an informational source for medical research, prevention of the disease, and establishing support systems for those affected and their families, to generate funding and financial support for diagnostic testing and try finding a cure. So far, they have raised $9 million for the research of Lyme's disease. The Lyme Alliance also works with the diagnosis with health issues and monitors the effects of the Lyme disease. These essential services ensure that a community's health assessment is accurate, and this is why we chose these few selected services. Within these 3 selected services, they all offer education along with support, meetings, discussions, and also monthly and weekly get-togethers.
In the 1990s, the vaccines Lyme, Rix, and Immune Line were approved by the FDA in use of the prevention of the Lyme's disease. Between December 1998 and 2000, over 1.4 million doses were given. But unfortunately, in February 2002, the vaccines were removed from the shelf due to other side effects happening. At this time, there is no other current policies that have been obtained. Enforcing Lyme's. As of right now, there are not any laws or regulations that are mandatory to protect the health and ensure safety with Lyme's disease in Connecticut. Linking. Children in Connecticut need treatment for Lyme's disease can seek help of Dr. Charles Ray Jones. Dr. Jones has been practicing in the field of pediatric and adolescent medicine in New Haven, Connecticut for over 40 years and has treated more than 15,000 cases of children with Lyme's disease. Assure. To assure the residents of the state of Connecticut that competent healthcare workers are dedicated to meeting their needs, HB 5528 was introduced. This act was concerning the essential public health services that was presented by the Public Health Committee in March of 2009. The effectiveness. The American Lyme's Disease Foundation has been known to be effective in preventing the spread of Lyme's disease through literature and educational pamphlets. The accessibility of the American Lyme's Disease Foundation is relatively easy. The Lyme Connection is a specific program targeted towards the citizens of Connecticut. The Lyme Research Alliance. The effectiveness is the Lyme Research Alliance is very effective because they have merged into a tick-borne disease alliance. They have become more widespread, and both organizations are effective in spreading the word of prevention. With the widespread infection of Lyme's disease, there are barriers that could interfere with proper treatment and conclusions of this sickness. Legal and ethical considerations can be and can take toll on this infectious disease, such as the major population that is targeted. Many parents have their own beliefs into why children should and should not have vaccines or treatment in regards to this infection. In the circular diagram that was provided, you will find the 10 essential services, with number 10 being at the highest importance. Research for new insights and innovative solutions of health problems. Since Lyme's disease is so in today's society and specific age groups that it's targeted at a higher rate, it's extremely beneficial to have solutions to this health problem. With the 10th essential service, it also functions in the assistance of assessment, policy development, and assurance. We have found an extremely important fact. Lyme's disease is directly linked by a tick bite. Will we ever be able to overcome and extinguish ticks? Maybe not. But with the high status technology that is formed today, we all feel that this disease will eventually be extinct.